Hello, Dr. Avinash. Tremendous honor to have you on the show. Could you introduce yourself, please?
Hi, I'm Dr. Avinash De Sousa. I am a psychiatrist by profession and also psychotherapist by profession. And I see patients with different psychological problems. And I'm based out of Mumbai, Santa Cruz. And also I teach students of psychiatry, psychology, etc. Yeah.
So the topic we are going to talk on today is integration of psychology and psychiatry. So why do you think psychiatry and psychotherapy should be integrated and not be mutually exclusive?
Well, I think all psychological problems are brain-based and they're also mind-based. And all psychological problems are governed by biological factors like the brain, psychological factors like the way we think, and environmental factors. And there are a lot of things that need to be spoken to, discussed, debated, deliberated, and rationalized. Everything cannot be just treated with a medication. So, for example, if someone has a problem with his spouse or sister or brother or mother, now those are either communication problems or these are either relationship problems, and these are things which they have to discuss in a therapy setting and find solutions for. It's not something that can be treated with a pill alone. A pill can manage the anxiety or the panic or the depression, but the pill is not going to manage your personal problems, your relationship issues, grief at the loss of a loved one. So you need to have therapy to understand the internal dynamics.
Right. So how can psychologists and psychiatrists work together for the therapeutic growth of the client?
Well, I think one of the biggest problems which I find a little endemic in our clinical setting today is that psychologists and psychiatrists don't communicate much. It's very important that psychologists and psychiatrists communicate. It's important whenever I refer out a patient for therapy, and I have a psychotherapist and a psychologist working in my clinic. So whenever we refer patients to each other, we have a session by session feedback which we give each other on the patient. Apart from that, there are instances where the psychotherapist and myself, we sit together so that we can evaluate the patient together from a biopsychosocial perspective, as I call it. And I can give her some tips to incorporate in therapy. She tells me some of her observations. The patient adds their inputs. The relatives add their inputs. And this might just be a 15-minute session, but it'll add a lot of value to the medical treatment I'm giving and the psychotherapeutic treatment she's giving. And I think it plays a huge role. And the synergy is what we want to achieve, which is, it's not that these are two separate treatments that run parallel. They are separate treatments. They work differently, but we want to get a good synergistic, symbiotic relationship between them, which is very important. And I think that will only happen if psychologists and psychiatrists communicate and discuss.
Right. So is prescription of medication required for every client seeking therapy?
No, I don't think so. I mean, I always say this, that we have around maybe 50 to 60% of patients that need medication. We have a good 30 to 40% of patients that may not need medication. There are some who may need symptom-based medication. So only sleep might be an issue, or anger might be an issue, or mood might be an issue. But then there are some who also need medication because we're treating a disorder like depression or anxiety or panic. And very often the medication helps stabilize the patient. The patient feels better and is more open and receptive in therapy. The patient is also more happier to communicate. He's also more receptive to suggestions given by the therapist, unlike when he's not on medication. And it can also happen that the medication provides an added boost or a biological support to the patient, particularly because he might be in an environment which is not very conducive to his growth at the moment.
Right.
And so the medication part it's very important. And I always tell the therapists who work with me that, please encourage patients to talk about medication. Therapists can be a huge ally when it comes to monitoring side effects, because patients talk to them about it. Patients talk to us also about it, and it's very important that we sort of appraise them that you're on this set of medications and these are the probable side effects. So if you do see anything which is hindering your work, do let us know. If you feel too sleepy, let us know. If there's no sleep, let us know. If you feel drowsy, let us know. I mean, these are all things which we communicate to patients, and patients, I think, should be empowered to know about the medications that they're taking and what they're taking and why they're taking. And I think that then makes them more receptive to the treatment.
Right, right. Okay. So could you cite a few cases where prescription of psychiatric medication is necessary to kickstart psychotherapy?
Well, if you have a patient that's very acutely suicidal, or you have a patient that is severely depressed, or you have a patient that's getting repetitive panic attacks which are not responding to psychotherapeutic methods alone, or sometimes the patient starts off with therapy, but therapy probably hits a roadblock after 4 or 5 sessions, and we feel that we need something to boost him or push him out of this. We've probably stagnated, more like a stalemate in chess. So we have stagnated. So we need to probably move on. So medication provides that added edge at that point of time. Also, patients who refuse to take treatment, who say, I don't want therapy, who say, I don't want to see a doctor. These are patients very often need some medication to make them feel better and develop an insight.
Right. But can they be treated without psychotherapy if only medication is being given to them?
See, it depends. Now, I always say this, that I always ask patients that, I feel you need a few sessions of therapy as well. And I always ask my patients, do you think you have a lot that you would like to speak to the therapist? Do you think that, there's a lot that you would like to share? Do you think that, a few sessions of therapy would do good? And I always tell them that sometimes even a few sessions of counseling and therapy, give you some insight. They give you some perspective which you probably won't get, which I think it's very, very important. And I think that's something which is very vital. And you might just get a different perspective from a third person, which enhances. And then there are some patients who do need structured therapy, so we really have no option but to look at therapy along with. But therapy alone, I think medication alone doesn't really work totally unless you have a patient who's been through therapy, has resolved all that therapy could resolve, and now he feels that I need little medical help to see me through. Or you have some patients who say we are too busy work wise, we don't have the time for therapy, so we just want to see you start medication. Yes, then at least some treatment is better than nothing.
And can it also be applicable for those who have biochemical imbalance?
Yes, but sadly we do not have any blood tests to detect these biochemical imbalances. So this is presumed on the basis of our clinical knowledge. So we always say that the medications act brain wise, the therapy acts psychologically, and social modifications act environmentally. So all three need to be put into swing together. So the medicine is a brain-based thing, and it alters your chemicals. It makes you feel better. The therapy works at a cognitive and a thought level, and social environmental modifications work at an environmental level.
Right. How can the therapist help taper off short-term acting medications like benzodiazepine?
Well, I think the therapist plays a very big role in anxiety, and the therapist can help the patient relax, teach alternative techniques, teach deep breathing, teach muscle relaxation, teach mindfulness and CBT based techniques. And once the patient finds that I'm able to use these techniques and I can avoid taking an emergency benzodiazepine, then overall in the long run we can look at tapering off these medications. So the psychotherapist plays a very big role when it comes to, finding alternative methods to cope, not just popping a pill, say during anxiety or during a panic attack. Even sleep, I mean, things like sleep hygiene, proper planning, scheduling of sleep, all these things might prevent you from just taking a drug at night.
Right. Okay. So as a mental health practitioner, how do you determine which form of therapy is most suitable for a client?
Well, I have always believed that an integrative and an eclectic approach where we combine different schools of thought work better. So you have some patients that need a cognitive behavioral approach in a session, then in the next session, they may need an existential approach. You have some who, need a psychodynamic understanding. You have some who need just supportive psychotherapy. So session by session, I think our approaches vary. And I always tell therapists that you have to learn all the approaches. Don't really look at, mastering one approach. You could master one approach and you could call yourself a CBT therapist, an REBT therapist, but that doesn't mean you get negative on the other approaches. Always be very open to integrating various approaches, because that
Right.
provides a lot of variety for you to play with from a scientific standpoint. And different patients benefit from different schools of thinking, and it could probably help.
Right. Can I ask you, what are your views on prescription of off-label medication?
Well, I think it's like this, that the issue is that most of the medications we prescribed are prescribed for an indication. And I don't think, there's anything like an off-label thing that is used. It's usually symptom-based pharmacotherapy. So we really don't prescribe anything like a hit and miss. It's always something that, we know about. It's always something we have used before. It's always something that we found effective. And that's the basis on which our prescriptions are based.
Right. Right. So I think we should stop the session here.
Okay.
It's tremendous honor to have you.
Thank you so much. Thank you so much. All the best.
Yes.
Always.
Thank
Yeah.
you so
Yeah.
much.